Cetuximab, also known as Erbitux Vial, is a medication used to treat a specific type of cancer that affects the colon, rectum, and head and neck. It works by slowing down or stopping the growth of cancer cells by binding to a certain protein called epidermal growth factor receptor, EGFR, in some tumors. Erbitux Vial is a man-made protein, also known as a monoclonal antibody. The dosage and timing of this medication will depend on your specific condition and should be determined by your healthcare provider. It is important to follow their instructions and take the medication at the same time each day for the best results. Remember to discuss any concerns or questions with your doctor or pharmacist. Erbitux Vial, also known as Cetuximab, is administered through an injection into a vein by a healthcare professional. This is typically done once a week or every 2 weeks, as directed by your doctor. In some cases, you may also be given another medication, such as diphenhydramine, to reduce the risk of certain side effects. The dosage of Erbitux Vial is determined based on your medical condition, body size, and how you respond to the treatment. After the infusion, a healthcare professional will monitor you for at least 1 hour to ensure that you do not have an adverse reaction. If you do experience a severe reaction, the infusion will be stopped, and your doctor may decide to discontinue further treatments. It is important to follow your doctor's instructions and report any concerns or side effects you may experience while taking Erbitux Vial. Some common side effects of Erbitux Vial include nausea, vomiting, constipation, diarrhea, headache, stomachache, backache, fever/chills, trouble sleeping, weight loss, tiredness, drowsiness, eye redness/itching, nail changes, dry skin, and mouth/throat sores. If these effects persist or worsen, it's important to inform your doctor or pharmacist. Serious side effects may also occur, but the benefits of this medication outweigh the risks. Your doctor will closely monitor you to decrease your risk. An acne-like rash is a potential side effect of Erbitux Vial, and depending on its severity, your doctor may make adjustments to your treatment plan. It's important to notify your doctor immediately if you experience any serious side effects such as mental/mood changes, swelling, signs of infection, signs of kidney problems, vision changes, irregular heartbeat, or severe muscle spasms. Serious lung problems are rare, but if you have trouble breathing or chest pain, seek medical help right away. While a severe allergic reaction is rare, it's crucial to seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects. If you're in the US, you can report any side effects to the FDA, and in Canada, you can report to Health Canada. Remember to always consult with your doctor regarding any concerns or potential side effects. While receiving Erbitux Vial, some people have experienced severe reactions, which can be fatal in some cases. If you have a history of tick bites or a severe allergic reaction to meat, such as beef or pork, your risk may be higher. It is important to tell your doctor about these conditions before receiving Erbitux Vial. Your doctor will closely monitor you during and after your infusion, and you should report any symptoms such as shortness of breath, hoarseness, itching, or dizziness immediately. Your doctor may stop the treatment if you have a severe reaction. Rare deaths due to heart problems have been reported in people with head and neck cancer treated with Erbitux Vial. Before starting treatment, inform your doctor if you have a history of heart disease, such as heart failure, irregular heartbeat, or a previous heart attack. If you experience chest, jaw, or left arm pain, shortness of breath, or unusual sweating, seek medical help right away. Your doctor will also order certain blood tests to monitor and help decrease your risk for heart problems during and after your treatment. Before using Erbitux Vial, it's important to inform your doctor if you have any allergies, especially to meat, or if you have a history of lung disease, radiation therapy, or heart disease. This medication may cause drowsiness, so it's best to avoid alcohol, marijuana, and activities that require alertness. Additionally, sunlight can worsen skin reactions, so it's important to use sunscreen and protective clothing. If you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits with your doctor before using Erbitux Vial. Always consult your doctor or pharmacist before starting any new medication. When taking Erbitux Vial, it's important to be aware of potential drug interactions that may affect how this medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure that you are using Erbitux Vial safely and effectively. If someone has taken too much Erbitux Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to have regular lab and medical tests, such as checking your calcium, magnesium, and potassium levels, while using Erbitux Vial and for up to 8 weeks after your last infusion. It's important to keep all your medical and lab appointments. Be sure to consult your doctor for more details on this. Remember, it's crucial to take each dose of Erbitux Vial as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule as soon as possible. This medication, Erbitux Vial, is administered in a hospital or clinic setting and should not be stored at home. It is used to treat certain types of cancer, such as head and neck cancer or colorectal cancer. The dosage and frequency of administration will be determined by a healthcare professional, and it is important to follow their instructions carefully. It is typically given through a vein, and the timing of the administration will depend on the specific treatment plan prescribed by the doctor. If you have any concerns or questions about the medication, it is important to discuss them with your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.